Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giridhar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is screening and tests for diabetes. According to the American Diabetes Association, 29.1 million Americans, or 9.3% of the population, had diabetes in 2012. Approximately 1.25 million American children and adults have type 1 diabetes. The percentage of Americans aged 65 and older remains high at 25.9%, or 11.8 million seniors diagnosed and undiagnosed. As per the recommendation of the American Diabetes Association, screening is essential for those with a body mass index higher than 25, regardless of age. Additional risk factors include high blood pressure, an inactive lifestyle, a history of diabetes in pregnancy. Other risk factors include high cholesterol levels, a history of heart disease, and having a family member with the disease. The National Preventive Services Health Commission has issued guidelines that those older than 45 should get an initial blood sugar screening done and schedule screenings every 3 years only if results are normal. If results are not normal, it is best to take next steps as per your doctor's recommendations. Testing for diabetes always takes place in a doctor's office or an authorized lab. Some doctors draw blood in their own office and send it to labs associated with their clinics. If not, patients can get a prescription and find out which labs work in sync with the insurance they hold. This can be done by calling the member benefits number on their insurance cards. There are four most commonly prescribed tests for type 1 and type 2 diabetes. Glycated hemoglobin or A1C test. This blood test provides information about the average blood sugar levels over a range of 2 to 3 months. Hemoglobin is the oxygen-carrying protein in red blood cells. Higher the blood sugar, higher the degree of hemoglobin with sugar attached. According to Mayo Clinic, an A1C level of 6.5% or higher on two separate tests indicates that you have diabetes. Below 5.7% is considered normal. This test cannot be used if you're pregnant or have an uncommon form of hemoglobin. Then there's the random blood sugar test, in which a blood sample will be taken at a random time. According to the American Diabetes Association, a random blood sugar level of 200 milligrams per deciliter or higher suggests diabetes. For fasting blood sugar test, a blood sample will be taken after an overnight fast. A fasting blood sugar level less than 100 milligrams per deciliter is normal. If it's 126 milligrams per deciliter or higher on two separate tests, you have diabetes. Finally, there is the oral glucose tolerance test. For this test, you fast overnight and the fasting blood sugar level is measured. Then you drink a sugary liquid and blood sugar levels are tested periodically for the next 2 hours. A blood sugar level less than 140 milligrams per deciliter is normal. A reading of more than 200 milligrams per deciliter after 2 hours indicates diabetes. Seniors must work in collaboration with their doctors and gather as much information as possible about the condition to be better equipped to manage it. One of the most important resources is the American Diabetes Association. The association funds research to manage, cure, and prevent diabetes, along with delivering services to hundreds of communities, providing information for both patients and healthcare professionals. They also advocate on behalf of people denied their rights because of diabetes. Their toll-free number is 1-800-342-2383. Another resource is the National Diabetes Education Program. It's a government program and a partnership of the National Institutes of Health, the Centers for Disease Control and Prevention, and more than 200 public and private organizations. It provides free information about diabetes control, prevention, resources for children, and awareness campaigns. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.